welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what we have for you all from the world of medicine. Can make a better lifestyle, even if not active before a cancer diagnosis. An exercise program that meets the unique needs can help get moved safely and successfully. Exercise has been reported to reduce the disease as well as treatment impact in patients with lung cancer. Nevertheless, there is limited information available regarding the perception of lung cancer, dedicated healthcare professionals, and their advice on exercise. An online survey exploring the healthcare professionals' practice patterns, their perceptions, barriers, and facilitators of exercise in patients with lung cancer was conducted, and the findings were published in the Lung Cancer Journal. The study, the total of 141 healthcare providers completed the survey. Overall, 63% of the participants declared that they frequently assessed exercise levels in their patients, and 43 of them reinforced the importance of exercise. However, only 10% referred patients to an exercise program or a specialist. Although the majority of the respondents had a positive perception regarding the benefits and safety of exercise, 2/3 of the clinicians reported not having adequate training about exercise counseling. The researchers hence concluded that healthcare providers should recognize the relevance and feasibility of exercise as a part of the cancer treatment intervention. Well-designed strategies and initiatives are definitely needed to support an effective referral in order to implement exercise interventions routinely in clinical practice. Whether patients with an alcohol use disorder who receive medical addiction therapy are less likely to develop the alcohol-associated liver disease. A recent cohort study investigated patients with alcohol use disorder, those who received a medical addiction therapy, and found that they had a significantly lower risk of developing the alcohol-associated liver disease, whereas patients with cirrhosis who received medical addiction therapy had a significantly lower incidence of hepatic decompensation. Findings were published in JAMA Open Network. They suggested that an association between the use of medical addiction therapy for alcohol use disorder and decreased incidence and progression of alcohol-associated liver disease. The medical addiction therapy was defined as the documented use of disulfiram, acamprosate, naltrexone, gabapentin, topiramate, or even baclofen. Patients were considered to be treated if they initiated the medical addiction therapy before the relevant outcome. The incidence of this disease was 0.37. This association was evident in naltrexone as 0.67, gabapentin as 0.36, topiramate 0.47, and baclofen at 0.57. In addition, pharmacotherapy for alcohol use disorder was associated with a lower incidence of hepatic decompensation in patients with cirrhosis, including naltrexone or even gabapentin. This association persisted even when medical addiction therapy was initiated only after the diagnosis of cirrhosis. The researchers concluded that results of the study showed that receipt of medical addiction therapy for the alcohol use disorder conditions was associated with a reduced incidence and progression of alcohol-associated liver disease. The benefits of plant-based diet and their effects on youth population. Healthy dietary patterns during the middle and the late adulthood have been associated with a lower risk of chronic obstructive pulmonary disease. However, this association of diet during young adulthood and respiratory health over the life course is quite unknown. A new study investigated whether greater adherence to a nutritionally rich plant-centered diet in young adulthood is associated with reduced longitudinal lung functional decline and decreased incidence of radiographic emphysema. A total of 3,850 young adults from the Coronary Artery Risk Development in Young Adults Lung Study, which is abbreviated as the CARDIA study, was administered and validated diet history was taken. The lung function was assessed through spirometry performed at different exam years. It was found that greater intake of plant-centered diet was associated with a less decline in the forced expiratory volume and forced vital capacity throughout the follow-up period. These associations were most pronounced during the first 10 years of follow-up. The researchers hence concluded that the consumption of a high-quality plant-centered diet in young adulthood was associated with a much better lung function, rather with a less lung function decline over a period of 30 years. Among current or former smokers, the adherence to a plant-centered diet was associated with a lower risk of developing radiographic emphysema over a period of 25 years. The effects of these antipsychotic drugs on pregnant women and their adverse effects on gestational diabetes. CNS Drugs Journal brought out a new study that aimed to assess whether the antipsychotic use during the pregnancy period is associated with gestational diabetes occurrence, and found that drugs like olanzapine, clozapine and quetiapine used during pregnancy were associated with increased risk for gestational diabetes and the infant being large for gestational age. A Swedish National Register-based cohort study included over 1 lakh singleton births. Antipsychotics were divided into 728 first-generation antipsychotics, 1710 in high-risk metabolic second-generation antipsychotics including olanzapine, clozapine and quetiapine, and 541 in other second-generation antipsychotics. The risk for gestational diabetes, the fetal growth disturbances, preeclampsia, caesarean section, and preterm labor were all assessed. The women treated during the pregnancy period were compared to women not treated during pregnancy and to women who used antipsychotics before or after during their pregnancy period. The risk ratio for gestational diabetes for women treated with high-risk metabolic second-generation antipsychotics during pregnancy was 2.2 compared to untreated pregnant women and 1.8 compared to women treated before or after their pregnancy. Exposed infants had an increased risk of being large for gestational age, while other antipsychotics were not associated with metabolic risks. Hence, the researchers concluded that olanzapine, clozapine and quetiapine used during pregnancy were associated with an increased risk for gestational diabetes and the infant being large for gestational age. The enhanced metabolic monitoring should definitely be considered for pregnant women using these drugs. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.